This episode of Wellness with Delaney is sponsored by Zen Principle. We all know the feeling. It's 10 a.m. and that first cup of coffee is starting to wear off. Cue the crashing energy levels and total lack of focus. So you find yourself reaching for a second cup just to take the edge off. And then around mid-afternoon, you start to feel that same familiar crash coming on. So you reach for your third. And then suddenly you realize you are stuck in a doom cycle of chugging more and more coffee just to make it through the day until you're on edge, jittery, and wishing there was a better way. Me personally, yeah, I've been there. But I recently found a solution that not only gives me that burst of energy that I so badly want, but it actually supports all day energy and focus without the crash and without the jitters. Meet Zentelligence Ultra Focus Nootropic Supplement. This comprehensive 8-in-1 formula supports cognitive function through multiple pathways, targeting focus, memory, energy, and mood support. Featuring powerhouse nootropics like organic lion's mane, alpine galangal extract, ceticoline, ginkgo biloba, water hyssop, L-theanine, and caffeine from green coffee bean extract. This supplement right here is a simple but powerful way to battle daily brain fog in the short term while also working in the long term to support the longevity of your cognitive health. So where a cup of coffee might give you a burst of energy for 2 hours followed by that horrible dreaded crash, Zentelligence provides up to 5 whole hours of balanced and focused energy completely crash and jitter free. As a busy health and wellness coach, content creator, and podcaster, I just don't have time to feel exhausted. So Zentelligence Ultra Focus Nootropic Supplement has everything I need for better energy, helping me maximize my productivity, but most importantly, doing so naturally and without anything artificial or shady. As a very holistic ingredients freak, this is something that I actually feel good about. And here's the deal. Unlike so many other supplements out there, Zentelligence is research-backed, using very clearly disclosed dosages for optimal transparency, and it's made in the USA in a GMP certified facility, which is basically a fancy way of saying it undergoes the highest level of scrutiny and standards to make sure you're actually getting the highest quality ingredients and benefits. So what the heck are you waiting for? Break up with that afternoon crash and shop Zentelligence using Delaney for 15% off. The link is in my show notes, so make sure to check it out and start giving your brain what it really wants. Hello and welcome back to Wellness with Delaney. We have a really fun chat today. It is Brooke Rose. She is actually a conventionally trained physician's assistant and she's turned totally holistic. So really interesting perspectives from a medical expert arena, but then also just like the practical holistic in her own life. So I'm really excited just kind of to marry those two together and bring in a really fresh perspective on so many different aspects of motherhood, of raising kids, of overall wellness. You guys are going to absolutely love this. Brooke, thank you so much for coming.
Yes, thank you so much for having me. Love everything you said. I'm totally ready to chat about all those things. So.
Oh, I cannot wait. So to start, would you mind just telling me a little bit about your background, how you became a physician's assistant, how you became a holistic physician's assistant?
Yes, absolutely. So, yeah, I am a board certified PA, and I grew up very conventional. I was always very conventional, I would say. My father is a conventionally trained physician. That was always our household growing up, and I was very deeply believed in that system. And earlier in my life, I probably would have laughed if you told me where I would be right now. I would have laughed in your face. But so I went through PA school and I started practicing in conventional medicine, and I was just fully immersed in that model. I've been in conventional psychiatry and internal medicine primary care. And then, so around that same time, I got pregnant with my first son while I was still actually in training. And then I would say that that was really kind of where things started to shift. And becoming a mom just shifted how I viewed health fundamentally, like at its very core. And so that was kind of the start. And there were two experiences that really changed kind of my path, I would say, from conventional to a more holistic mindset. So with my first son, when he was about 6 months old, due to a mistake by his pediatrician, he was given a double vaccine. So he got an extra dose of a vaccine he wasn't supposed to get. And that was just jarring for me. That was the first time being on like the opposite end of being the mom instead of the provider in the medical system, and to see the reaction or the lack of reaction, I should say, of the pediatrician office and his doctors and everything. They had no reaction. So it was that response that kind of led me to questioning things, I guess, a bit more. And there was no accountability and there was no acknowledgement of my concerns as a mom. Luckily, thank God, he seemed to be okay. We haven't experienced anything we know yet of like long-term effects. He seems okay right now, but that was terrifying and really opened my eyes to the modern medical system, I would say. And then, so at the same time, that had happened. And as I said, I was practicing in conventional medicine as a PA. I was seeing 20 plus patients a day in 10-minute appointment slots, basically just doling out drugs, medications and drugs. Um, and it started to really take a toll on me. I, um, I just saw my patients getting sicker and sicker, basically, and I couldn't do anything except hand them a pill. And so I really felt called by God through all of those things to start exploring like how to um, heal in a better way and to ask some deeper questions. And that kind of led me to exploring some functional medicine and holistic health training. And I ended up doing some training and certifications in that area. And then, so yeah, it led me to understanding the whole body better and kind of the body's innate ability to heal. And that led me to starting my virtual practice now, which is a holistic health virtual clinic. And then, so I primarily work with women and families, understanding and supporting them through really all stages of motherhood, I say. So, like preconception, pregnancy, postpartum, and then all like their children as well. So, babies and children's health and wellness. Um, and so, yeah, that was a long-winded answer to your question.
No, I love it. That's really awesome. And I do always feel like everyone has that moment. They're like that they just question everything. So I love that you touched on that. And then obviously now being in just a different form of practice, but still having your conventional background and then moving into the holistic. Do you still bring in aspects of conventional medicine or are you like fully crunchy in your practice now?
So I definitely say that I combine the best of both worlds. That's what I always
Mm,
tell. That's what I always tell my clients or my patients. So I'm not against conventional medicine or modern medicine at all. It 100% has a time and a place, but I don't think that modern medicine shines through in preventative care. It shines through in like
mm.
emergency medicine, surgery, things like that. I don't think that we our treat our bodies the best way preventatively from a modern medical standpoint. But I still do prescribe medications. I still do work like with the conventional system. It's just not my go-to or my
Mhm.
first instinct anymore.
Yeah. Oh, I love that. Yeah, because it's always there. And obviously, like if I get in a car accident and my leg is like bent at a
Hmm.
crazy angle, it's like, yeah, I'm gonna want somebody that knows how to, do all those things. But
100%.
then at the same time, when you're going in and let's say for women for preconception, like you mentioned, like they want to work on their hormones, they want to work on these things. Like there are so many other avenues that are lifestyle oriented. So I think that's always great to have that as the first line of defense at the very least. I love your approach. And then for you being a believer, love that that's part of your story and part of your practice. How does your faith shape the way you view like the modern medical world or how people interact with doctors in today's day?
Yeah, yeah, I love that question. So as I briefly mentioned before, but I really started viewing things more through a faith lens during pregnancy and when I had my first son. So before that, I wouldn't really say that I had a really strong personal faith. It just was never really a strong part of my life growing up, and I understood the body physiologically and intellectually through my medical training, but going through pregnancy and birth and breastfeeding and everything was completely new for me, and it really opened my eyes in awe of like what exactly the woman's body was designed to do so intelligently and perfectly. and especially breastfeeding too. Like it just made me realize that the female body isn't just a collection of systems. Like that's how we go through training in PA school. We learn like about the heart, and then we learn about the lungs, then we learn about the reproductive system and things like that. And it's just so obvious when you're a believer that everything was so intelligently designed to be interconnected by God. And so that just, I would say the way I approach it now is that it just made me feel like there's a lot of intention and design with the body, and knowing that um, I just like to trust the body's instincts and natural ability first. So
Mm.
I always like to give the body, especially the female body, the support that it needs to do what it was intended to do by God. And for children too, that's my approach with my children and everything on that end. So it basically to trust in God's design and focus on stewarding the body well. And I really believe that the body is something we've been entrusted with, and something we're called to care for intentionally.
That's beautiful. So then do you think, and I don't know what you're going to say here. I'm just curious. Do you think that today's society idolizes doctors in modern medicine like on a spiritual level?
Oh, 100%. Yeah, I think that's a big issue with modern medicine and humility. And you can see that, and not to say that everyone in modern medicine is this way, but I think there's a clear difference in medical providers who have faith and believe in God and those who don't. Because when you believe in God and you have that faith, you know that medicine, humans, this earth is not everything. There's a greater purpose, and no matter what you do, you're not in control of everything. And on the opposite end of that, for people who are not believers, as a medical provider, you kind of believe that like you are the God and you can control and manipulate everything as you see fit. And you see that a lot with vaccines too, like people who aren't believers, they yeah, they just think that medicine is their God, basically, in my opinion.
Yeah, absolutely. And now that you mentioned vaccines, like let's get into that. So obviously, I think people are going to see your background and be like, "Oh, she's super pro-vaccine." But I think that there might be more nuance or more surprise to that answer. So for you in general, like what is your philosophy around vaccines?
Yeah, and I think that anybody hearing the first part of this podcast would think that, but if you go to my social media, you would know that there's more to it. So, yeah, I used to be super pro vaccine. Like I never questioned any of it. It was just it's a rite of passage as a conventional medical provider. So after everything that happened with my son, and then the research that I've done and everything like that, and growing closer to God, I believe that vaccines should totally be an individualized risk benefit scenario for each family. Like no child is the same. So it doesn't make sense to provide a one size fits all schedule for every baby and child without taking anything else into account about them. Um, and on top of that, I don't believe that health is injected or given in a pill. I think that health is something that's built foundationally every day in the choices you make for yourself, for your family, your kids, and that can never be replaced or replicated by a vaccine.
Yeah, absolutely. And I think we've seen this in the past few years. This topic has gotten so polarized, which I find, just really fascinating to see how people have reacted to the topic of vaccines. And it
Yeah,
makes people really angry on both ends of the aisle. I've noticed
it
like
does.
if I were to say for me personally, I don't vaccinate, I get just the angriest DMs. People be like, stop spreading misinformation. You're using your platform for evil. And I'm like, okay. And then, but on the other end, when you see people who are super pro vaccine, you see the people on the other end being like super angry. And I think it's really interesting that like we just don't seem to acknowledge as a society that like everyone can make a different choice. And that's informed consent at its at its best. I
Yeah.
want to get into some of the like common ones because I often like if I say a stance on vaccines, people will be like, well, what about this one, this one, this one? So for like pregnant moms, what about the RSV vaccine?
Yeah. So, the RSV vaccine during pregnancy, you mean? So there's
Yes.
2 RSV vaccines. You can either take the RSV vaccine during pregnancy. If you don't do that one, you can give your baby, your newborn, the RSV vaccine. So in general, my stance on vaccines in pregnancy as a whole is I don't do them. Um, and but it's still really a risk versus benefit scenario for
Yeah.
each mama. Um, my thoughts why I don't take them personally during pregnancy is so based on the concept of epigenetics, which is the known way that our environment, everything around us influences our genes, right? So it's known that things like the food that you eat, what you put on your body, what you're exposed to in the air, in your home, your stress levels, everything like that impacts your genes and the way your body functions. And so I think about that with pregnancy and when you're literally growing an entire baby from scratch. Their genes are literally being written, their DNA is being written as you progress through pregnancy and grow. Anything that you put into your body or take into your body or in your environment is directly impacting baby. So in my mind is something as simple as eating a bag of Doritos versus eating an apple can have some impact on baby. And of course, it's not that simple, but I'm saying to make a point. If something like that can impact your baby, what does that mean for vaccines
Mm-hmm.
during pregnancy? So that's kind of how I look at it. My general mindset is the less intervention and the less things I can put into my body during pregnancy, the better, and just kind of support it the best I can, stewarding it, like I was saying, the way God intended. Like we were designed for this. Our bodies know what to do when they're given the proper support. And I don't think that we need to be intervening a whole lot, especially with vaccines.
Mm.
Um, and to talk some like logistics about RSV itself. So if you do get the RSV vaccine during pregnancy, it's given later in pregnancy because if you get it earlier in pregnancy, it does have some risks of preterm labor. So you have
Oh.
to get it in your third trimester. And when you get that vaccine, so it offers short-term protection from RSV for baby for about 5 months after they're born, and then it wears off. So it's really a short-term thing. It's if babies are being born in the winter time when RSV is highest, and if they have any like medical complications or anything that would put them at high risk, that's when I think it would be a bit more applicable to a situation. But otherwise, most healthy children, like the average baby, especially if you're being breastfed, most healthy children don't need it, in my opinion.
Mhm.
It's generally a mild illness. Almost all children will get it at some point by the time they turn age 2 anyway, just because it's so ubiquitous in the environment. And most children get it. You might not even know they have it, and they recover just fine.
Oh wow.
Um, it's really a risk more for the babies who have any underlying like genetic or medical conditions, especially related to the heart and lungs. Um, and in situations like that. So again, for most healthy children, preventing RSV is not something that you need to be like super concerned about, in my opinion.
So this is interesting because I feel like, obviously, whatever season you're in, Instagram just shows you.
Yeah.
You know what I'm saying? Like the
Yeah.
algorithm is algorithming, and so for me personally, what I see so much is so much fear and only extreme cases of RSV, right?
Mhm.
Like it's always like babies in the ER and like on the verge of death, and it is scary. Like it's scary as a pregnant mom to see that, and so to hear that like it's not always this super aggressive disease is
Yeah.
actually pretty comforting, because I don't even know if a lot of pregnant women or new moms realize that there are like so many cases of mild RSV. I think people hear it and it just sounds like a death sentence.
Yeah, the majority of cases are mild. You wouldn't a lot of times you wouldn't even know that you have RSV probably unless you go to the doctor and get tested for it. It
Wow.
just looks like a general cold or flu for most healthy children. Of course, you can't say that all the time. There's always going to be those like you can't predict. Some healthy children can have worse outcomes and complications too, and we can't predict that. But for the most part, if you are a healthy, especially breastfed baby or child, you are going to recover just fine from it.
Okay, I love to hear this. And then let's say for parents who, especially parents who want to go the holistic route and not do the vaccine, but even ones who choose the vaccine, I'm sure even if you're vaccinating, you're wanting all the tips still to promote healthy immune systems. So, what are some general rules of thumbs with newborns to help prevent serious illness without a vaccine in question?
Yeah, so I love that question. Number one would be breastfeeding.
Hmm.
First and foremost. I don't think that we promote breastfeeding enough, and it's not mom's fault at all for the most part. Like our system is just not designed for it. It's a fundamental flaw in the system here in the US. There's lack of support, lack of funding, everything, all the things. So, not to shame anybody, but breastfeeding is the number one most important thing you can do. Breast milk literally programs your baby's entire immune system from the time they're born. It builds up their
Wow.
gut microbiome, which is where over 70% of the immune system is housed, and it provides thousands and thousands of antibodies and important biological factors and enzymes every time you breastfeed. So 100% super important. And another thing that's really cool, so breast milk helps with the respiratory illnesses, significantly reducing um, severe outcomes of any of the scary like respiratory illnesses. So like flu, COVID, RSV, pertussis. There's been studies that actually show that exclusive breastfeeding in children less than 6 months old reduce severe outcomes from pertussis by up to 75%
Wow.
just from breastfeeding versus vaccination and breastfeeding, which reduce it by severe outcomes of pertussis by about like 90% or so. So even with just breastfeeding alone, if you're not vaccinating, you get such good protection from these respiratory illnesses.
That's
Um,
incredible.
it is, yeah. And so number one would be breastfeeding. Number two would just be being smart about exposures. And I would recommend this for any newborn or baby, whether they're vaccinated or not. I mean, I would, especially in the wintertime, just be smart about exposures. If you're going out in public, traveling, things like that, I would just keep baby close to you, baby wear. So, yeah, so I would just keep them on the boob, only pull them out like to feed or keep them in the stroller or on your chest, or only mom and dad holding them. I would be cautious about anyone outside of the household holding them or getting close to them in their face, anything like that. Definitely no kissing or anything in the face. I know that's a big one and that's tough to say no to for a lot of families. But yeah, I would just set that hard boundary and just keep people away, at least for the first few months or so.
Hmm. When it comes to no kissing, does that apply to mom and dad, or is that just for like outside people?
I say people outside the home.
Okay.
So if babies, like if mom and dad both live in the home and are regularly interacting with baby all the time, I don't think that's an issue. Yeah.
Beautiful. Yeah, do you have
Yeah.
any tips? Because this is actually something that I worry about where, um, especially I feel like in different cultures, let's say, like there's people just like cultural melting pot families, and there can be a lot of offense when you don't pass a baby around like a party favor. I think it's interesting how everyone seems entitled to hold a newborn.
Yeah.
Personally, I find it strange. Like I've
Yeah.
had people be like, "I just want to hold your baby," and I'm like, "Well,
It's a
you
little
might
weird.
be in for a rude awakening."
Yeah.
You're
Yeah.
gonna have to wait. Or people who are like, well, we kiss so our kids and they're fine and da 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 da. Like, what do you have any practical tips for parents who are navigating the uncomfortable conversations of, hey, I'm not passing my baby around, you can't kiss my baby, that kind of stuff?
Yeah, it's tough for sure. I think just holding those hard boundaries and remembering why you're doing it, like an uncomfortable conversation or awkward encounter for 30 seconds to a minute and then it passes versus like God forbid somebody outside the home passes something to your newborn and they get really sick and it's a hard few days or a week where they end up in the hospital or anything like that. I think just number one, first and foremost, your job is to keep your baby safe and protect your baby. And if family members get upset and pissed off about that, I I think they can just deal with it.
Yeah, that's a them problem,
Yeah,
which I love that. I'm personally not a people pleaser, and I feel like since getting pregnant,
yeah.
the last ounce of self-preservation really just left my body. But I know there's a lot of other women who struggle with that and men too. And I think especially I feel for women who like don't have husbands who are willing to like be the bad guy too. Cause I'm like, when you're freshly postpartum and learning how to be a mom and all these things, like I think it's so important for the men listening to like guard that space and to be the bad
100%.
guy. Cause it's like if a woman is also trying to be the bad guy, breastfeed, all these things, and like just spiking your cortisol, I'm like, that can't be good for everything as well.
Yeah, 100%. That's a really good point, actually. I think the husband needs to step in that scenario and be the one. If the mom wants to do it, I mean, all power to you, go ahead. But I think that's a really important job that you can talk about for dad ahead of baby being born, being like, okay,
Hmm.
I'm going to take the lead on this and I'm going to make it known to people so you don't have to be in that uncomfortable situation. That we're not having like a ton of visitors. We're not bringing baby out and about. There's not going to be hot potato baby and and kissing and things like that. That's a really good job for dad and to help support mom and take some of the mental load off for sure.
Hmm. Absolutely. Yeah. And it's like, honestly, I just feel like if somebody doesn't respect that decision to the point of causing conflict, they're not your people anyways,
Yeah,
Like
yeah,
the people I want in my life are going to be respectful even if they don't agree. And that's the beauty of like you create your own
100%.
family. You get to figure out who really is in your corner.
Yeah,
Okay, so I'm
100%.
curious because a lot of people who I've either talked to or heard other people talk to, or especially like for friends that I have that are single and they're looking for men who are also anti-vax, a lot of people will be like, well, like I understand not getting the flu vax, the COVID vax, all these things, but polio is the one where I'm really just not sure. I think that there's a lot of lore around the polio vaccine and what that did for society. And I'm just really curious, like, do you have any insight or perspective onto like whether people should be getting the polio vaccine these days?
Yeah, polio is a whole rabbit hole. So, yeah, so the we have not given it to our boys. So mine are 1 and 3 now, and they haven't had it. My thoughts, what I like to draw people's attention to, I always like to ground it in real world risk. So for any vaccine, you can look at real world exposure risk and then real known side effects of the vaccine um, and then apply that to your child's individual situation and their personal risk in today's world. So, in developed countries like the United States today, do we see polio? No, it's not the same as like pertussis, flu, measles, things like that, which we do see case counts of. Running around today in the United States. So it's just not the same. The exposure risk is not the same. Now it's a little bit different because polio can have a lot more dangerous, severe outcomes than something like the flu for the most part. Obviously, everybody's scared about like the paralysis, iron lung, the in being in a having your leg in a in a crutch. So yeah, but I think it's important to recognize what the actual numbers are for that. So with polio, about 95% of all polio cases are totally asymptomatic. Like
Wow.
you wouldn't even know you have it. 90 to 95% of all cases. The rest of those cases, about 5 to 10% or so, have a mild kind of flu-like illness, like a stomach bug, flu-like illness, something like that, and then it goes away. And then less than 1% of those infections will actually turn into some kind of paralysis. So, of the total amount of people who even get a polio infection nowadays, which is minuscule, less than 1% of those will end up with some kind of paralysis. Now, that's not to say the paralysis isn't life altering and terrifying. But what's the exposure risk? Very small. We don't have polio in the United States anymore. I think the last case was in 2022, I believe, and it was a vaccine-derived case
Wow.
from another country. So, in the United States, we give the inactivated polio vaccine, and in other countries, they use the live oral polio vaccine because it works a lot better. So places where there's a higher risk of polio, they tend to give that one. However, that one, since it's live, it sheds a lot, and it's known for causing. You can give it. People who have been vaccinated can give it to unvaccinated people. So I believe that case, the most recent case that was in the United States, was from a vaccine derived case from somebody else.
Wow, wait, okay, so walk me through this. So the vaccine that people get, the live vaccine, it protects them, but it puts other people at a greater risk essentially if not everyone gets it.
Um, so yes,
Okay.
yes. So in other countries, they use the oral live vaccine, which can shed, which all live vaccines can shed. Some we know that, like, that's a thing with measles too, and
Hmm.
so we know that they shed. We just see more commonly vaccine-derived cases from the oral polio vaccine used in other countries specifically.
Wow. Okay, and I love this because I think especially around COVID, which we'll definitely get into, but like there were so many people that would say like, oh, if you don't get the COVID vaccine, you're being selfish to all the vaccinated people, which to me was a little like, I'm like, well, if you trust your vaccine, why do you need me to get it? But now it's like, okay, well, also it's the reverse end with some vaccines, it's like, we can call the people who don't get it selfish, and I don't think anyone's selfish for the choice they make personally, but it's interesting that like depending on the vaccine, it could technically be passed and forth, like back and forth from being
Yeah.
vaccinated. So I think that's so fascinating and something to like mentally chew on, that it's not just this one-sided like you need to get a vaccine to keep me safe. There are also like other cases where the last case of polio could come from somebody who has the vaccine.
Yeah.
Which kind of leads me
100%.
which leads me into to COVID, because here's something that I found interesting, and the flu, like kind of bundling them, which I know they're different vaccines, but like I always see the people who got all the COVID shots and the people who always get the flu shots are the people who get sick the most often. Like I
Mhm.
feel like the people who are like just got the flu shot all have the flu right now. Or same with like COVID, the people who got the COVID vaccine or got like 5,000 boosters constantly had COVID, and some of them still claim that they get it. And so then that leads me to be like, do these vaccines even work?
Yeah, that's for flu and COVID specifically, my thought and opinion is no. Like, I think we've all seen that. It was kind of exposed during COVID. It doesn't it doesn't work. Um, they kind of changed the narrative. They originally said that it was, well, if you take the vaccine, it'll prevent you from getting COVID. And then they saw that wasn't true. And it's like, oh, okay, well, actually just take the vaccine because it'll prevent severe outcomes and complications if you have the vaccine and you get COVID. And so it changes based on what narrative they want out there. But yeah, I mean, the flu shot is anywhere from like 30 to 50% effective each year, not any greater than like 50 to 60% effective
Wow.
max. It doesn't it doesn't work that well. COVID shot doesn't work that well. And to your point, yeah, like you said, you feel like you see people who have all these shots that get sick all the time. I see the same thing. I see it in patients. I see it in like other kids compared to my kids and to unvaccinated kids versus vaccinated kids. I've seen the vaccinated kids. all seem to be sick all the time, like back to back to back. And it is actually a thing with the flu shot. Right after you get the flu shot, it does increase your susceptibility to getting other upper respiratory infections. So if you just get the flu shot and then let's say you go out somewhere, you travel in a crowded area, you're more susceptible to coming down with another type of virus or something that you might not have been as susceptible to prior.
Wow, this is just so crazy to me too, because I remember in the peak of things, maybe like 2021, 2022, I would hear people be like, "Yeah, man, I got COVID and I was sent to the hospital, but thank goodness I had the vaccine or it could have been so much worse." And I was like, maybe, like, I don't know, and I try to be loving and listen, I'm not gonna judge, but I got COVID once. It was a bad flu and then
Yeah,
within 2 weeks I was back to normal. And I was like, I didn't need a vaccine to do that, but a lot of people I know who got it, and it was like after getting the vaccine or getting multiple were like, "I almost died, but can you imagine if I didn't have the vaccine?" And I'm like,
yeah,
I mean, I'm not gonna say, like, I don't know the exactly what's going on in your body. Who's to say the vaccine didn't help? But, like, I don't know, my common sense analysis is telling me that maybe the vaccine didn't save you in this case because you had it really, really bad.
yeah,
And I don't know, it's a hard one because it's obviously so personal, but I just am like, I'm just not convinced that they work, like, that
yeah,
any of these shots work. I'm like, I don't
yeah.
know.
I actually did get the COVID vaccine because I was in PA school at the time. And so we were told that a lot of places for our clinical rotations wouldn't take us. You have to be up to date on your vaccines to do your clinical rotations
Mhm.
and complete your program and graduate. So it was basically a choice of eating the hundreds of thousands of dollars that I'd put into and time and energy that I'd put into my education and training to do this career and walk away or get the vaccine so I can participate and graduate and all of that. So I took the
Wow.
vaccine. And at that time, I wasn't nearly where I am now. I wasn't really questioning things at all. Back then, I was like, sure, sure.
Yeah.
So I did take it. And then after that, I had COVID like at least 3 times. And it
Wow.
got worse every single time. It didn't, I mean, I don't even think I know for a fact I would not have been in the hospital or ending up with severe complications 'cau well, not for a fact, but I'm a healthy person. I don't think that I would have
Yeah.
been ending up in the ICU or anything. But I think that my COVID symptoms were worse after I got the vaccine for sure.
Yeah, and,
Yeah.
I think this is important too because there's also, like, a level of people and I never wanna come on here and, like, shame people or fearmonger, right? And so, like, I obviously have my thoughts about vaccines and you have your thoughts, and, like, you can be a holistic person and have gotten a vaccine before, and it's not necessarily a death sentence, like, you can always move forward and get healthy from there, and I think that's really important for, like, forward thinking because I never want to create an environment where people are like, "Well, I've done all this. I'm screwed," because that's not true. For you, and I'm sure you probably have some insight here too, like as somebody who like, you got the COVID vaccine or like you've gotten other vaccines before. And I think probably most of us have at least gotten one as a kid, unless our parents were like way ahead of the curve, right?
Mhm.
I know I got some as a kid. Luckily, my parents stopped when I was like maybe 10, but still had a few. So for people who've had vaccines, especially if they've had them recently, or maybe they got the mRNA, like, and they're concerned about their health or their fertility or all these different things that they're seeing and hearing, do you have any tips for like detoxing or promoting health after vaccines?
Yeah, I think that's a really good point. Like you said, we don't want to make it seem like, oh, you took this one vaccine, you're doomed. It's
Mhm.
definitely not like that at all. I think that the the foundations that you lay every day are so much more important. The environment that you're creating for yourself is so much more important than just one vaccine. So, like your body, if you're a healthy person, metabolically, physiologically, you treat your body well. Like your body is in a good place to recover just fine from a vaccine. For the most part, truthfully, a healthy body, a healthy individual can recover well from illness, and it should be able to recover well from a vaccine too. So it's really just about focusing on those foundations every day, and you don't have to stress too much about it, in my opinion. Um, and then your body naturally detoxes on its own anyway. Like, it was made to do that. If you can support your body's main detox pathways, like through healthy diet, sleep, staying hydrated, nutritious diet, things like that. And I don't think that for the most part, like, aggressive detox protocols are necessary. There are a couple products that could be helpful, especially if you're vaccinating like a younger baby, and especially if you're getting a couple at a time, or more than one in general at a time. One of my favorite supplement brands, Dr. Green Life Organics, she has a couple kids detox products that you can give before and after the vaccine. But other than that, I don't think there's anything a whole lot you need to do besides just supporting your body's natural ability to be healthy and to detox and clear things.
Beautiful. Yeah, I love that because I think it is so important for us to also like, I can, I have my strong opinions, but I also don't want to ever make someone feel like, they're coming here and they're like, wait, I'm literally doomed for the rest of my life. Like, no,
Yeah.
that's not the case. Let's just
Yeah.
move forward in a healthy way and, take care of your body. So, kind of moving, not a vaccine, but just kind of moving into another intervention that's a really hot topic right now, vitamin K. I'm sure you've seen all over the internet. There's some fighting on the internet about and it's hard. This is a hard one because I
It
think
is.
there's
Yeah.
fear on both ends. Like, I'm seeing fear on getting the vitamin K shot. I'm seeing fear on having vitamin K deficiency and internal bleeding and all these things. I would love to hear your philosophy, where you stand, and if you just have any insight to bring to this discussion.
Yeah, vitamin K is a tough one for sure. It's not a vaccine like you said. It's something separate. So, um, and this is one that's definitely become more difficult for me personally, and my views have kind of evolved as I've grown in my faith and grown closer to God and everything, but, regardless, some of the facts physiologically still remain the same. So, all babies are born low in vitamin K. I don't like to say deficient, but all babies are low in vitamin K. And vitamin K1 specifically is what helps your blood to clot. So babies are not born with that ability. Um, as they grow and their gut starts to mature and things like that, and through breast milk, formula, whatever, they start producing vitamin K2, but vitamin K2 doesn't help as much with clotting. So K1 is the one they really need for clotting, and that gradually comes in over months and like the first year of the baby's life. So without any vitamin K supplementation at all, there's a risk for vitamin K deficiency bleeding, which is why the supplementation exists. And the bleeding is rare. It's definitely rare, but when it does happen, it's a serious event. It's usually internal bleeding, like a brain bleed or a gut bleed that you can't see, and it happens quickly and it's difficult to manage, or like bleeding at a circumcision site if you get circumcised and you don't have vitamin K, something like that. So the rates are pretty rare, but can be severe when it does happen. Um, there's 3 different types of vitamin K deficiency bleeding. So, if it happens within the first 24 hours or so of life, that's early bleeding, and that really only happens for mothers who are taking certain medications during pregnancy, the biggest one being, warfarin, and then there's classic BKDB, which, happens from about the first day to about 7 days or so of life. And then there's late BKDB, which happens after about the first week or so of life. And those numbers again are all small, but severe consequences can occur if they do happen. So yeah, so the shot is one large bolus dose for baby, and it prevents against all of the types of bleeding. um, and it creates a little depot in them, and it slowly releases the vitamin K um, over time. Versus the oral vitamin K, there's a few different regimens out there, but the oral to mimic that is usually dosed a few different times over the first few months of baby's life. So the regimen that we used with our second son that I personally recommend that has the most research behind it is 2 milligrams one time after birth, and then 1 milligram once weekly for about 12 weeks. Um, and there's always the argument that oral vitamin K doesn't work as well. And that's just not true for the most part, as long as you're strict to the protocol. So it's more so when you veer off track or you're not following that continued dosing appropriately. But there's this huge study done in Denmark on over like 400 or 500,000 babies who were given that protocol, and there were no cases of bleeding in any of those babies following that protocol that I just mentioned. So, um, if you wanted to go the oral route, I think the oral route is perfectly acceptable. I would prefer the oral route over the injection if you are going to do vitamin K. That's a different discussion whether you want to do vitamin K at all or not. That's personal choice and a choice something you can pray about. And if you feel like babies don't need vitamin K at all because they were designed perfectly by God, that's a separate conversation. But if you're choosing between oral and the injection, I think that the oral is a perfectly acceptable and better alternative in my opinion because it doesn't come with all of the extra ingredients in the shot.
What are some of the ingredients in the shot that would be concerning to new parents?
It's just filled with like a lot of fillers and additives and things like that. One version, the typical version, has um, benzyl alcohol, and it's known to produce serious adverse effects in some babies, a serious allergic reaction. You can ask your hospital for a preservative-free shot. Not all hospitals carry it. It kind of depends on the hospital and the provider and things like that. But that is an option. There's other ingredients in the preservative-free version still that I'm just not a fan of. I also just don't think that personally I didn't want to inject my child with something like the minute they come out of the womb anyway. So
Yeah.
um, yeah, I just didn't want anything even in the preservative-free one.
Yeah.
But if you are going to go with one of the injections over oral or nothing at all, I think the preservative-free option is a better choice.
Yeah, there's like, like the worst, better, good, best
Yeah,
kind of sliding scale. So then
yeah.
for the oral, is it something that you get on your own or is it something that's like provided by your medical provider?
So, yes, that's something you can order yourself. Again, Dr. Green Life Organics, she makes a great one. That's the one we used. It's just on her website,
Okay.
and it's vitamin K1 or vitamin or baby clotting help or something like that. I think there's a couple others out there. I haven't really done too much research into the others because that's the one I like. But I would say if you're gonna order it somewhere, just make sure it's a reputable source. Don't get it
Mhm.
like on Amazon or something like that. I
Oh
would order it
gosh.
directly from like a trusted website.
100%. Yeah,
Yeah.
Amazon is not the place you want to be getting supplements for your newborn baby if you're gonna do them. And then so I'm curious too about this because I hear this on the other end as well. Like there's always the argument that like a baby's immune system isn't ready, and like I might butcher this, but like a baby's body isn't ready to process vitamin K. And so then I hear a lot of people on the like in the on the crunchy side too being like, there's a reason their bodies are low, like they're not ready to handle it. It's not good for them. What are your thoughts on that perspective overall?
Yeah. So, yeah, the injection gives baby one big dose of vitamin K, even though it's supposed to be released like slowly over a few months, whatever. It's still putting it in their body. way sooner than their body or their gut would be ready to handle that on their own or produce it on their own. So that is a consideration. I don't think that it's a huge consideration for their immune system in particular because vitamin K, it's not a vaccine, it's not stimulating their immune system in that way. However, it is a foreign substance being injected into your 1-hour-old baby. So just think about that in terms of like their overall health and their what their little system needs to or not doesn't need to come into contact with in those first
Mhm.
couple hours of life and what their gut is ready for. I mean, all of their organ systems are still so underdeveloped at birth. They continue developing like their gut, their brain, their liver and kidneys. It all continues developing over that first year or two of life. So um, a, a, a newborn baby isn't gonna process things the same way that an older baby or older child would.
Yeah. So then for somebody who, let's say, decides not to do any vitamin K after like at all, oral or injection, are there aside from like the medicine component, right, for the first 24 hours, but just for like the classic and later stage vitamin K deficiency bleeding, are there any things that moms can do and dads can do to prevent bleeding holistically without administering vitamin K?
Yeah, there's not really a whole ton that you can do on that end that I've found in my research. If you're not going to supplement, if you're breastfeeding, so breast milk is naturally low in vitamin K, which
Mhm.
brings up the other point of course, if you believe, why would breast milk be low in vitamin K and babies are born low in vitamin K? Like that makes you think that there's, of course, a reason, right? Um, and so if you're formula feeding, however, formula has vitamin K in it. So if you're formula feeding, there's usually very few cases of vitamin K deficiency bleeding in formula babies. But with breastfed babies, which I of course encourage, there's not a whole lot you can do unless you're going to give the drops. Because like I said, that the bleeding is usually internal. And it's not something that you can like see or do much about. It's like a small brain bleed or
Mhm.
a small gut bleed or something like that.
Gotcha. And I know you mentioned that it is like with all this in mind that it is rare. How rare is it to have your baby experience bleeding?
Without any vitamin K supplementation at all, the bleeding occurs in about 4 to 7 per 100,000 infants.
Okay, so really
So,
rare.
yeah,
Yeah,
very rare.
I saw a post. I can't remember if it was a doctor or a nurse or PA. It was somebody in the medical field. And this is what really stressed me out because I had kind of decided I was like I don't really want to do anything.
Mhm.
And then this woman is posting she's seeing vitamin K deficiency bleeding in 1 in 60 babies. And I was like, that
Hmm.
doesn't seem right. I was like, that seems off because everything I've read has been like it's extremely rare. And
Yeah.
I was
No,
like,
that cannot be right. That has to be something else, like some type of bleeding that's not
yeah,
actually vitamin K deficiency bleeding that's just labeled that way or something like that.
yeah. Because I was
Yeah, it's
really
not.
shocked by that. And I was like, that goes against everything that I've researched and
Yeah.
seen and heard and read. And it felt a lot like fear mongering because it was like a really angry post about,
That's
and
what
then,
that's what I was gonna say too, like,
mhm,
that is fear-mongering, not
yeah.
like, that is intentionally to fear-monger. Yeah.
Exactly, yeah, and, like, all the comps, people just, like, angry and people nurses being, like, so angry at people not getting the vitamin K shot and all these things, and I'm like, "First of all, how did I end up on this corner of Instagram?" I'm like,
Mhm.
"Algorithm, you have not been listening." But also, like, it was I just was really surprised to see that, and it made me like, "Wait, what?" Like, backtrack. That is so different than everything I've read and seen, and what you're saying is much more in line with that. Like I've seen that like it's so rare. But I think it's also important for people to, regardless, even if it's rare, to know the risks, know the benefits of everything, and that's how you make an informed choice. Because what kind of hypocrite would I be if I told everyone like don't do all these things because I said so, right? And I have a lot of friends now who are
Right.
pregnant, and it's like the same thing where they'll be like, "Well, what are you doing? Like, what do you think about this?" And I'm like, "Well, I'll tell you what I'm doing, but." And
Still up to you.
obviously Yeah,
Yeah.
and it's like, obviously, if you chose to not vaccinate your children, I would totally be cheering you on. However, I do not want you to make that decision based on me. Like, I can't be your intuition, and I also don't want to be I don't want the
Mhm.
responsibility of being someone's intuition because nobody's gonna think for the child the way a mother can, and if something goes wrong, like, I don't want that on me. So
100%.
it's
Yeah.
interesting because 'cause I'm like, I also still want people to know all the risks and benefits of everything so that they can decide, and, like, yes, my prayer is that people choose a more holistic route, but that's gotta be because they decided that, you know?
Right. Yeah, I totally agree 100%. And there's risks to anything and everything, especially medical interventions, which is so bizarre to me. Like we acknowledge the risks and benefits of anything else in the medical world. But when it comes to vaccines, it's like, no, there's no risks. You couldn't possibly have a bad outcome from a vaccine. It couldn't
Yeah,
possibly do anything bad. But with like any medication you take, it's like, here's a list of side effects that you might experience. And you get to decide if you want to take it or not. But we can't do that with vaccines. So yeah,
yeah,
I think recognizing that there's risk to any decision you make, any medical intervention you do, there's risks to taking a vaccine, there's risks to not taking a vaccine. It's just whichever risk you're more comfortable with personally. And I think that if you are not going to vaccinate, that puts a lot of responsibility back in your hands, in your family, and you have to be willing to accept that responsibility and um, live wisely and just kind of like what I was saying in the beginning, treat your body the way it was intended, like support health foundationally, be intentional about your health so that when you do come into contact with illness and things like that, because kids are always going to get sick. They will always get sick. Their bodies and your body and everything is in a place to recover well from it.
mhm.
A vaccine isn't gonna make you healthy.
Yeah, absolutely. I think that's a great perspective. Okay, so last question before we move on to your health goals and wrap it up. But one thing I've been kind of digging into with people and other doctors is like the topic of circumcision. And this really was born when I didn't know if I was having a daughter or son. I like knew in my heart I was having a daughter, but I wanted to prepare for anything. So I was like, what if
Yeah.
I'm just wrong? And so my husband and I started talking about circumcision. And I was like, I feel like my weird nerdy trait is that anytime everyone does something in that standard protocol, I immediately am like, "Well, let me see. Do I think this because everyone thinks it, or do I think it because it's aligned with what I think and my research and my intuition?" And so I was like, I always was very, very pro circumcision. And then when I got pregnant, I was like, "Am I?" And I started, like, research, and I had Dr.
Yeah.
Chafee on recently, and we talked about it, and I was like, "I think I'm actually not." Like, I think
Yeah.
I actually am not pro circumcising a newborn. Obviously, there are cases maybe when they're older, like, if there's a need, but I'm like, I just feel like for me, it started with, like, well, when you're putting a baby, yes, people say, "Oh, they don't remember it," but I'm like, "But the body remembers, the nervous system remembers everything."
Yeah.
That's why, like, birth trauma is a real thing, right?
Mhm.
And I was like, "Well, I just don't know." Like, it's the same way where I wouldn't wanna pierce my newborn's ears, which that's a whole other can of worms that
Yeah.
people probably don't wanna hear, but I'm like, "Why would I cause a baby pain they can't understand?"
Yeah.
So as a medical provider from, just knowing the reasoning and the risks and all of that, like, what do you tell your clients and patients regarding circumcision?
Yeah. It's a circumcision is another tough one, and I have 2 boys, so we we had tough decisions at our house too. But I think that kinda like what you said, I love what you just said, like, anything that everyone just automatically does, like, question the status quo, like, why is it that way? Why do we all do that? Um, if you look at, like, across cultures throughout the world, like, most other cultures don't circumcise. Um, it's really interesting, and the reasons that we do it mostly in the United States are, well, one, they will try to tell you it's for, like, medical reasons, which I 100% push back against. I don't think that being uncircumcised is inherently unclean or poses a greater risk of infection in and of itself. I think that's a responsibility that the parents take on if you're choosing not to circumcise. It's just about teaching proper hygiene and like cleanliness. So I don't think that that's a valid excuse. Um, and then you have like the moral factors, you have the biblical perspective. Morally, ethically, is it right um, to cut off a piece of a body part of a baby when they can't consent to it and they can't say anything about it? But you also have to think about this baby's going to grow up to be an adult, and what are they going to wish they had or hadn't or don't have when they're older, because you have to realize that circumcision um, is a the way they do it in conventional medicine is a little barbaric in my opinion, but it's a relatively quick procedure and then it's over, and the recovery is usually pretty smooth, um, versus an adult getting circumcised if they did choose to go that route when they're older and they can make that choice for themselves. Um, morally, that seems right, like, that seems good to let them make that choice for themselves, but it's a much more difficult procedure, and more difficult recovery for them when they're older. So, I think as parents, you take on the medical choices, the medical responsibility for your children anyway until they turn 18. Like, you're making the medical choices for them. So I think you can view circumcision in that lens. Whether or not you want to do it, it's a medical choice that you make for your child. I think you more so want to think about like your personal feelings about it, why you would do it or not do it. For us personally, I kind of defaulted to my husband a little bit more on this one, because I'm like I can't personally relate. So
Yeah.
I we talked about it, prayed about it. I asked his opinions, and he ultimately made the final decision for our boys because he knows more in that area than I do. But again, it's another highly, highly individualized and personalized medical choice. And biblically, I don't think it's wrong either. Like the Bible encourages circumcision and talks about it a lot. So I think it's really just about what you think is best and what you want to do for your child.
Yeah, absolutely. And I like that you brought up the biblical perspective too, because I think this one trips up a lot of Christians because, like, obviously, when like Jesus does not like say you can't do anything in the Old Testament, but he also comes and like the law, like the old laws are removed, and there's a lot of debate in the New Testament about like are these uncircumcised people like can they be people of God?
Mhm.
And ultimately, they're like, yes, like you can be uncircumcised and like enter the kingdom of God. They don't say you have to be uncircumcised. They don't say
Mhm.
you have to be circumcised. So I think that's what's nice is like there is freedom there. It doesn't seem like, especially in the New Testament, there's not one route that's like absolutely sinful and absolutely like God's way.
Yeah.
Uh, and this is where I think that the I always say it, and so it's become like my classic saying that I always say to people, but I'm always like, you have to insource your intuition, like
Yeah. 100%.
really pause. And it's nice because if you like, especially if you know the gender before you give birth, but even if you're surprised, you have some time. Like you don't have
Yeah.
to make a decision the first time you think about it. Like I think it's really good to pause and pray and like take your time with these big decisions because it is a big
100%. Yeah, that's what I say too. Like preconception and the 9 to 10 months of pregnancy is the perfect time, especially if it's your first child and you don't have to deal with another
yeah.
child. The perfect time to research all these decisions and kind of like talk with your partner and pray about it and figure out where you stand on these things and just dive into as much research as possible. But yeah, I think for circumcision, the biggest things are just I wouldn't do it again out of fear, fear of like medical complications or infections or things like that. I think that's pretty much dispelled. It's more so just about what you want for your child and what beliefs you and your partner have about it, and then also thinking what and it's kind of hard to say like what choice would they want when they're older. Would they rather have that choice themselves? um, or would they be happy that it's done? So,
Yeah.
and it's kind of hard to say. So that's something that it's just such a personal choice.
Yeah, that is a hard one. I think it's such a big responsibility when you're making decisions for a future adult and like wanting to do right by them. But I also think that like if you hold that in such like high regard and respect that,
Yeah,
then there's grace, like we're all gonna make mistakes or maybe do things our kids don't love. But I think ultimately that's where that humility comes in, and that like, no, like this is a big deal, thinking through
yeah,
those things through that lens is so important. So okay, I
100%.
I would love to know from you, because you're such an expert on so many things health and wellness, and even beyond. Like I know we talked a lot about pregnancy and babies and motherhood today, but you share just a lot of practical wellness as well. So I think you're really living it out. What is your health goal right now? Like, what are you working on?
Yeah. So right now I have been pregnant and breastfeeding for like the past 4 years straight, 4 to 5 years. So right now I'm really just focusing on like building my body back up,
Mhm.
basically, making sure I'm at the healthiest state possible, like metabolically, nutritionally, restoring like nutrients and minerals, working on my stress. Oh my gosh, my stress, working on my stress levels is a big one right now. And just kind of like grounding myself, making sure that my body is in the healthiest state possible after such a demanding season of life, which I'm so grateful for, but kind of a transition period to get myself in the healthiest state possible before we hopefully have baby number three.
Oh, that's amazing. Well, I'm really excited to see that journey for you and just see what that
Yeah.
leads to. Where can people find you if they want to go deeper and connect with you?
Yeah, so right now I'm on Instagram at Rose_holistic health. And then I'm starting a YouTube channel as well. So I'll be posting on there. And I'm pretty active on social media. And so I also do through my practice, Rose Holistic Health, I do one-to-one vaccine consults that are an hour long with families to talk through any of these decisions, like personalized for your child more specifically. And then I also do functional medicine programs and consults, functional medicine lab testing and ordering for children and adults, mostly women. Kind of shifted more towards working with women in that like preconception, pregnancy, postpartum, early motherhood phase. So,
That's beautiful. Amazing. Well, you guys, if you love this episode, then make sure to give Brooke a follow, reach out, connect with her, because she really does have so many resources. And if you're even not in the stage of life of like parenthood right now or prepping for parenthood, she just has a really awesome resources and things that you can really learn from and draw from. I know I've really enjoyed her content personally. And as always, thank you so much for listening. I hope you have a wonderful rest of your day, and we will chat so soon. Thanks so much, Brooke.
thanks.